Hi everyone, welcome back to my channel Physiotherapy Decoded. Myself Dr. Ayushi Thakur, and in today's video we are going to talk about the ACL injury and its physiotherapy management. Before starting the video, do not forget to like, share and subscribe my channel. And also, if you want the notes of this topic, do comment below in the comment section, or you can also message me in the Instagram. So now let's start with the video. So what is ACL? ACL stands for Anterior Cruciate Ligament. It is a strong band of tissue inside the knee joint. So, an anterior cruciate ligament is like a rope, a strong band of tissue that connects the thigh bone, that is the femur, to the shin bone, that is the tibia inside the knee joint. So, the function of ligament is to connect bone to bone, and the function of the tendon is to connect muscle to bone. So, here the anterior cruciate ligaments connects the femur to the tibia. Now, talking about the function of ACL. It prevents the shin bone from moving forward too much. It helps in stabilizing the knee. The anterior cruciate ligaments helps in stabilizing the knee joint, and the third function is it works with other ligaments of the knee to keep the knee strong and balanced. Without ACL, the knee may feel unstable and may give way during movement, or the patient may feel that the knee is moving forward too much if there is any ACL tear. Till now we have discussed about the anatomy and function of ACL. Now let's study about the mechanism of injury. ACL tear hota kaise hai? What are the main causes of ACL tear? So the first one is sudden stop and change in direction. For example, a footballer running fast and then quickly turning or changing in direction. In this, the ACL tear may happen. The second one is landing incorrectly. A basketball player jumping and landing with a bent knee. ACL tear may occur. Direct blow to the knee. For example, a tackle in the football hitting the outer side of the knee. And the last one is overextension or hyperextension. For example, a gymnast landing with a locked straight knee. So these are the four causes, or these are the mechanism of injury of ACL. So now let's move to the types of ACL injury or the grades of ACL injury. So we have divided the grades of ACL injury into three: grade 1, grade 2 and grade 3. Grade 1 is mild sprain. In grade 1, the ACL is stretched but is not torn. The knee is stable but mild pain and swelling may occur. Second one is grade 2, that is partial tear. The ACL is partially torn but is still connected. The knee may feel unstable and painful with swelling. And the grade 3 is the complete tear or the complete rupture of the anterior cruciate ligament. The ligament is completely torn into two pieces. The knee cannot feel stable and give way during movement. And in grade 3, surgery is required for the patient to be fully recovered. So these were the three grades of ACL. इन ग्रेड 1 जो लिगामेंट है वो स्ट्रेच हो जाता है बट टीयर नहीं होता. ग्रेड 2 में पार्शियल टीयर हो जाता है बट जो नी जॉइंट है वो फिर भी स्टेबल होता है. और ग्रेड 3 में नी में इंस्टेबिलिटी आ जाती है और जो लिगामेंट है उसका कंप्लीट रप्चर हो जाता है. ओके, सो नाउ मूविंग फॉरवर्ड टू द सिम्टम्स ऑफ द ACL इंजरी कि अगर ACL टीयर होता है तो उसके क्या क्या सिम्टम्स होते हैं. फर्स्ट ऑफ ऑल यू विल हेयर अ पॉपिंग साउंड फ्रॉम द जॉइंट, अ पॉपिंग साउंड एट द टाइम ऑफ इंजरी. Second one is immediate swelling in the knee. Then severe pain and difficulty moving. As I said that ACL helps in stability of the knee. So if the ACL is torn, you will feel difficulty in walking. Fourth one is the knee feels unstable or loose. And the fifth one is limited movement. So these are the 5 symptoms of ACL injury. A popping sound will be heard, there will be swelling, there will be pain, there will be limited movement, there will be instability of the knee, and there will be swelling. Now, talking about the diagnosis of the ACL tear. So, in clinical findings, we perform 3 tests, that is Lashman test, anterior draw test, and pivot shift test. Lashman test is the most common test to identify the ACL tear. Anterior draw test is done to check if the tibia is moving too forward or not, and pivot shift test is done to check the instability of the knee. So these tests are performed in the clinical findings. If we talk about the investigations, then first X-ray is done to rule out any bony fractures, and then MRI. MRI is performed to confirm the ACL tear and to check कि नी जॉइंट के किसी और स्ट्रक्चर में कोई डैमेज तो नहीं हुआ है. So in the next part of the video, we are going to talk about the physiotherapy management of the ACL tear. In today's video, we have discussed about the anatomy and function of the ACL, its mechanism of injury, the grades of ACL tear, the symptoms and diagnosis. Do not forget to like, share and subscribe my channel. And now I will see you in the next video of the ACL tear. Thank you.